It's important to put this in perspective. If we were actually to look at the science of what's going on or the statistics of what is going on, 85% of people over 65 have been vaccinated. 85% of the country over 65 has been vaccinated. A third of the country has gotten the disease and has natural infection. Some of them have been vaccinated too. Some have gotten the disease and been vaccinated. But we have huge numbers. If you want a vaccine in our state, you can get it. There's really no limitations now. Pretty much anybody can get it. I don't know if children are under certain age are allowed to get it because it hasn't gotten approval for that. But the vaccine is out there. The numbers, if you look at daily incidents, have gone through the peak in January and are down low. The deaths went through the peak in January and are down low. There's no real evidence that we should still be doing this. And even states that have had significant lockdowns, or even New York's going to be ahead of us in opening up. So when the governor says that we need to vaccinate 2.5 million people, the burden should be on the governor to say why. Why that number? Where's the scientific proof that we need that? Where's the evidence that we still have a great problem in Kentucky? Everything about Kentucky says that we don't necessarily have that problem. And much of the reason we don't, I think, is because we're a rural state, and the rural states have largely done better than the urban states. But we're stuck in sort of this place. But I think the biggest thing is it can't be one person's opinion. We really need to be in a democratic republic, multiplicity of opinions that come together and somehow consensus forms government. And that's what we have to, I think, truly be concerned with. One of the things about schools that I think puts it in perspective is that more children have died from suicide than from COVID. Can you imagine? And suicides are up.
That suicides are definitely up, and that is one of the things I don't like about let them play or let them learn, is because parents, have reached out to me, and I don't say I don't like it. I don't mean it like that, but it's tough.
You've had to hear
it's
this.
Tough. Yeah. You hear. I grew up on a farm, so in a small rural community about an hour away. So I understand the limitations that often rural Kentucky and rural America have, and it's just incredible. And I don't know what the numbers are now, but you were speaking of people not logged on. I do know that Jefferson County back in the fall was estimated between 5,000 and 10,000 that had never logged on. I know that the Kentucky Department of Education on their website estimate between 50 and 100,000 that don't have internet. I know when we went virtual here in Fayette County, 12,000 kids didn't have a Chromebook, and we have sent these kids on their way in homes that maybe aren't as good as they need to be, with families that don't have jobs or have made tough decisions, and mom's not working because she really is trying, or maybe mom's by herself and grandma's helping. The information just continues and continues.
And we did all this without an iota of evidence of significant spread in the schools. Not one study. In fact, every study showing the opposite. And we also have the experiment in all of our communities of private schools that have stayed open and not had any kind of super spreading event or any kind of surge in the community among the students or the teachers.
And our surrounding states have been in, much like, I think Indiana has been in since August. They've had a couple, quirks and things that they've had to do, but Tennessee's been in. Virginia, West Virginia, they've all been in at least 3 times, if not 4 times more than Kentucky. And we're still struggling to get in.
I think we're going to wind up here pretty soon. Does anybody else have any subject or statement you'd like to finish up with before we draw things to a close?
I think we need to say that I'm not envious of anybody that had to make any of these decisions. I think there's a lot of tough choices that had to be made, not a lot of information, a lot of changing information. I in no way envy having to make those choices, but I think making those choices and providing some evidence to support it, and maybe considering options or just maybe sticking with something and letting us all know. But we appreciate, I think I can speak for everyone when I say we appreciate those who are trying to get us safely reopened and get things back in focus. It's got to be a tough job to be making these choices and figuring out mandates and PPP and EIDL. So I am very appreciative of those who are working like you to get things reopened and to figure this out, because it's got to be a tough job.
I think you've hit the nail on the head about tough decisions, because when you think about it, the way a free society is set up is like if you're accused of a crime, you're presumed to be innocent. So you go before the court, and it's the burden of the government to prove that you're guilty. You don't have to prove that you're innocent because you're assumed to be innocent. It's the same way in a free society. You're assumed to have your liberty, and if government wants to take of your liberty, it's their burden to prove why. And it should be a big and a steep burden to say to a business person, we're going to dictate what you can, or to say to someone who's in convention planning and event planning that we're going to do this. It is their burden. And if it's going to be extraordinary to take away your freedom to make these decisions with the people you contract with, it has to be extraordinary. There has to be scientific evidence, there has to be proof of it, but there also should be the imprimatur or the approval of the legislature. You know, no one person should get to dictate to you how to run your business or how many people can be in your store or what your clients can do. Because here's the danger: when you let one person decide, that person could make a mistake. Now, the whole legislature could make a mistake, but at least now you've had a debate amongst a lot of people, and you have this give and take and checks and balances. But this has sort of been the argument against the centralization of power all the way down to one person. It's sort of why we fought the revolution. We didn't like having a king. You know, we wanted to have that power dispersed so there would be debate. So I think this is an issue of our time. Not only is it devastating to your individual businesses, but this is a real issue of whether or not you're presumed to be free and the government has a burden to prove why they want to take your liberty, or if you can have some public health person just write a note and say, go arrest them. I mean, we have lived through the last year where the police were sent to churches to take down license plates. I think it's also important to say it's not that I don't care about safety. If you asked me in March of last year, if you were 85, should you go sit in a church for 2 hours? I'd say I'd advise against doing it. So, I mean, there is advice, and I think most people, see, I tend to think in a free society, in our society, people are smart enough to take advice from experts, filter through it, and make a decision. But also, if you ask me if you were 25 years old and wanted to go sit in a church for 2 hours last March, I'd have probably said, you know, your risks are much less. You'll have some risks, you could get sick, but the chance of dying is 1 in a million. So I think people could take that advice, and this would be advice that we give to people. But there's a difference between persuasion and edict, and it isn't one size fits all. We're not the same. I mean, one of the things that, because we've had this sort of monolithic advice that we failed to tell people, and I tell people everywhere I go, there is something that can save your life, and nobody's telling you this. If you get COVID, particularly if you get COVID and you're overweight, 80% of the people going in the hospital or dying are overweight. So if you get COVID and you're overweight, you need to be much more cautious and careful of your symptoms to look for treatment. But there is a treatment. It's called monoclonal antibodies. President Trump got it, Chris Christie got it, Giuliani got it, but there's a window of time. If you don't get that treatment and you get sicker and sicker and sicker and you go to the hospital and they have to put you on the ventilator, they'll say the monoclonal antibodies don't work, you missed your window. And I don't hear anybody on television telling you that, so you would know that if your mom or your dad got sick and they were getting sicker and beginning to cough, that you got to get them in soon, and you got to advocate to get them the monoclonal antibodies. The doctor has to make the decision, but I promise you, being an advocate and a family advocate can make a difference. And it's about an 80% reduction in death. In fact, what they're doing for people, if you're living in a house with someone with COVID, let's say it's 2 elderly people, the woman has it, she's 85, and her husband says, I'm not leaving, I'm her only hope, and I'm going to stay with her. They can actually give the monoclonal antibodies to him, too, before he gets it. And sometimes it either prevents them from getting it or they get an incredibly mild case. And instead, we're insist on making a 2-year-old wear a mask on a plane, and, you know, making a young kid with autism who's 7 or 8 put a mask on a plane and holding them down and kick them off planes. Instead of somebody saying there are ways we can save your life, you know, through medication, there are reasonable things you can do if you're at risk to avoid this disease. And to let people know the reasonable and obvious evidence that we're getting beyond this, that everything shows that we are getting beyond the part of this, and hopefully we'll be getting beyond it soon. I want to thank you all for participating. We wish you the best of luck in your business. I tell people that I think our job in government is to make it easier for you to succeed in business. I can't help you with the business, but I can try to help keep government out of your way. And I think in the last year, we've done nothing but put obstacles in the way of your business. We've had family businesses, restaurants run for 60, 80 years, go out of business. You know, but gone through several generations of family members, and then all of a sudden it's gone. Something had been built up for generations. That's very sad. So I hope we will see some sense very, very soon. I hope the Supreme Court will look at this of Kentucky and say, we cannot, let